Hey everybody, and welcome back to another anatomy video. In this video I'm going to be going over the heart. Following this video, actually in a separate video, the link of which you can find in the description right below, I'm going to have a testing video where I'll go ahead and throw up images of this model. I'll ask a specific question. You can go ahead, pause the video at home, answer the question. I would also recommend writing down that answer, and then hit play. I'll throw the answer up so you can check that you not only have the answer right, but that you also know how to spell it as well. You'll need to know, obviously, how to do both for the exam. When I go through the interior portion of this heart, I'm going to be doing it as though I were a blood cell, basically, and the route that I would be taking. So if you're still unfamiliar with the flow of blood through the heart, I think this video should help. I'm also going to include, though, a video that has an animation of that. It's a real quick video, but I think it lays things out a little bit easier than me verbally explaining it, and you know, if you can't beat them, join them. So I'm just going to use that video and put it in the description so you can go ahead and take a look at that as well. I don't want you to be discouraged by the length of this video. I know it is fairly long. There's just a lot of terms to go over here. I will be giving you some nice tips and things like that to remember certain structures as well. So I think it would be well worth your time to watch this, and obviously it's all fair game for the exam. Everything that I'm talking about in this video is relevant. So, you know, let's just go ahead and take this on. Okay, everyone, so the first thing that I'm going to talk about in this lesson is the difference between the base versus the apex. The base is made of the two atrium as well as some of the vessels coming together, and that forms what we would call the base of the heart, whereas the apex is when the two ventricles come together. A nice way to remember this, actually, is the fact that if I took this heart, turn it upside down, it shouldn't take too much of your imagination to be able to draw a triangle around this. And if there's anything that you can remember about basic geometry, it's the fact that on a triangle, the base would be down here, and the apex would be up here. So the base is formed by the atrium and the vessels coming out, and the apex is formed by the ventricles coming together. Next, let's go ahead and talk about the three main vessels that carry blood, deoxygenated blood, I should say, into the right atrium. First, we have our superior vena cava up here, and we also have our inferior vena cava down here. It's been cut away, but it would also run all the way down here. It would actually run through your diaphragm as well. The superior and the inferior vena cava, what they do is they are essentially the final vessels that carry deoxygenated blood from systemic circulation back into the right atrium of the heart. The third vessel is going to be what we would call the coronary sinus. The heart, on top of supplying the entire body with blood, it also has its own unique blood supply, which runs through coronary vessels, which we'll talk about at the end of this video. But all those vessels will eventually converge and become the coronary sinus right here. And this is the final vessel that's carrying the deoxygenated blood from coronary circulation into the right atrium of the heart. And we can actually see that coronary sinus right here. It's that red dot. That's going to be the entrance of the coronary sinus. So again, superior vena cava, inferior vena cava, and the coronary sinus right down here. Then the blood is going to go into the right atrium. It's deoxygenated blood. It's then going to travel through the tricuspid valve into the right ventricle. The right ventricle, when it contracts, is going to shoot the blood up on its way to the lungs. And the first thing that it's going to go through is the pulmonary semilunar valves. These are called pulmonary semilunar valves because of the fact that when you, and if you've done the heart dissection, you already know this, they look like half moons. So these are the pulmonary semilunar valves. The blood then travels up the pulmonary trunk and out the pulmonary arteries. It then becomes oxygenated in the lungs and comes back in through the pulmonary veins and goes into the left atrium. At this point, I do want to break something down for you because a lot of students seem to have a lot of trouble with this. Typically, on our models, our arteries are going to be red. On the circulatory model, on the coronary arteries and veins, the arteries are typically red. This is the rule, and if you can follow this rule, it makes all this make a lot more sense. An artery is a vessel that always carries blood away from the heart. Okay, A for artery, A for away. That is the rule. At the same time, a vein always carries blood back to the heart. Again, that's the rule. There are no exceptions to those rules. If you can remember that, it makes understanding why the pulmonary trunk and arteries are blue and the pulmonary veins are red. Okay, let's think about this. The fact that this blood is deoxygenated, right? It's coming back from circulation. It's all the oxygen's already been used. So it's going to travel up the pulmonary trunk, right? And then out the pulmonary arteries. And again, it's blue because it's deoxygenated, but they're called arteries because they're carrying blood away from the heart to go to the lungs. Whereas the veins at this point, the pulmonary veins, they're coming to the heart, right? And a vein always carries blood to the heart. But because it's been oxygenated, these pulmonary veins are red. So that should make sense. And if you need to review that one or two more times, if it's still not making sense, just go ahead and, I guess, replay that part of the video. But it is something that I think confuses a lot of people, and hopefully that kind of explained it for you. So we also have right here our left atrium, okay? And then going down here, we have the bicuspid or the mitral valve. You will probably see it as the mitral valve, so make sure that you know that term. The blood then goes into the left ventricle. Then when the left ventricle contracts, it shoots the blood up through these valves known as the aortic semilunar valves, okay? Just like we had the pulmonary semilunar valves here, we also have aortic semilunar valves right here. The blood is then going to travel up through the aorta. The aorta can be divided into several different parts, 3 of which we can see on this model, 2 of which you can't see, but they are fair game for lecture, so I'm just going to talk about them real quick. The aorta, we have right on this model, we have the ascending aorta, ascending because it's going up, arch of the aorta, or the aortic arch, okay, because it makes an arch, and then we have the descending aorta right here. The heart, again, would sit in the body like this. So once we get past what we call the descending aorta, it's going to continue on down. I have my diaphragm at about right here. Okay, anything above the diaphragm is part of the thoracic region. Anything below is part of the abdominal region. So once the descending aorta stops, it's going to continue on as the thoracic aorta. And then once it passes to the diaphragm, it's going to become the abdominal aorta. Now, something that I want you to keep in mind here, it's not like the aorta is bifurcating or anything at this point. It's the same vessel. We're really just changing the name depending on the location of what we're pointing at. So I don't want you to think that the vessel itself is changing. It's just the name at this point. But just do be familiar with those 5 different divisions of the aorta. Again, 3 of which you can be tested on with this model. The other 2 are totally fair game for lecture. So just make sure that you pay attention to that. Coming right off of the aorta as well, we have what we call our coronary arteries. We would have a right coronary artery right here. It's this little nub that I'm pointing to. And then there's also the left coronary artery right here as well. Okay? And again, the heart has its very own blood supply, and these are the very beginning vessels to that coronary supply of blood that we have. I'll talk about the other coronary arteries and veins at the end of this lesson, but just be familiar with those 2 for right now. Now, moving on into some other structures within the heart, we have right here these structures known as chordae tendineae. We see them in the coming off of the tricuspid valve, and they would also be coming off of the bicuspid valve as well over here. The chordae tendineae attach to muscles known as papillary muscles. So on these models, if you see the chordae tendineae attached into a muscle, that's going to be a papillary muscle that it's attached to. What these actually do, blood is going to open up the tricuspid and the bicuspid valve on its own, just due to pressure differences in the 4 chambers of the heart. So a lot of people think that the papillary muscles are like pulling on the chordae tendineae to open up those valves, and that's not the case. What they're actually doing is they prevent prolapse of the tricuspid and the bicuspid valve back up into the atrium. The way that they do this, okay, let's say that this is the right atrium up here and the right ventricle down here. The blood is going to travel through, okay, and the valves are going to open as the ventricles are filling with blood. So it's traveling from the atrium into the ventricles. When the ventricles contract, it forces the tricuspid valve shut, Okay? And if we didn't have the chordae tendineae and the papillary muscle that were essentially holding them in place, the tricuspid valve would actually prolapse back up into the atrium. And we don't want that because we want to make sure that this is an efficient system and the blood's flowing in one direction. So think of the fact that, think of this actually. One of my professors brought this up and it always helped me remember it. Think of your friends Pappy and Larry holding onto the chordae tendineae to prevent the valves from going back up into the atrium. So your friends Pappy and Larry hold the chordae tendineae. That's a kind of a fun way to remember it, and it's pretty hard to forget if you can just remember that. I also want to bring that up because there are other muscle ridges that we find in the ventricles, and I don't want you to get them confused. We also have muscles called trabeculae carneae, and trabeculae carneae are these muscle ridges. You can see them on the inside of the ventricles here, but you could also theoretically point to them inside of these parts of the ventricles as well. It's essentially the muscles that aren't, or the muscle ridges, I should say, that aren't papillary muscles are going to be trabeculae carneae. So just keep an eye out for that as well. We also see in the atrium, okay, up here, muscle ridges known as pectinate muscles. Okay, and a way that I like to remember that and not confuse it with like trabeculae carneae or papillary muscles is I kind of like to think of this as looking like an upper body. Okay, and if I put this up here, these would be the equivalent of my pectinate muscles or my pecs. Okay, I'm sorry, or my pectoral muscles or my pecs. And so we call the muscles inside here the pectinate muscles. It's just a nice little way to remember it. I always like having different ways to recall things for exams and things like that. So, hopefully that helps you out. Let's talk real quick then about the septums. We have right here what we would call the interventricular septum. Okay, inter means between, ventricular for the fact that it's between the ventricles, and a septum is essentially a wall that divides two chambers. So the name makes a lot of sense. Interventricular septum right here. We also have an interatrial septum, and if I were to take my two fingers and try to touch them through the atrium, I can't do it. It's because there's a wall there. And that wall is going to be what we call the interatrial septum. Again, inter between, atrial for the atrium, and a septum, a wall that divides two chambers. Interatrial septum, interventricular septum. Okay? Inside of the, and like on the wall, I guess, of the interatrial septum, we also see a structure right there known as the fossa ovalis. It used to be the foramen ovale. It was a hole in the fetal heart that allowed blood to go directly from the right atrium into the left atrium because we didn't need as much blood going to the lungs as a fetus. We needed blood for like development and things like that, but you're not breathing as a fetus and you're getting all the oxygen from the mother. So there was a couple different ways that the heart developed to essentially bypass the lungs and try to get most of the blood just directly into systemic circulation for the rest of the body to use during development. We also see up here, okay, the remnants of what used to be called, well, it's called now the ligamentum arteriosum. It used to be called the ductus arteriosus, and it was essentially a vessel that allowed the blood that was traveling up the pulmonary trunk, as opposed to having all of it go to the lungs, right? Because again, the lungs, we weren't breathing when we were a fetus. It allowed the blood to go directly from the pulmonary trunk right up into the arch of the aorta so that it could go down and essentially be distributed through in systemic circulation. And so, again, now it's called the ligamentum arteriosum, and that's what you see right here. But it used to be called the ductus arteriosus. So just keep an eye out for that as well. Again, that's for the lecture exam. It's also on the fetal model as well, so you could be tested on that when you're looking at the fetus. So just keep that in mind as well. Okay, I'm going to finish off the interior of the heart right now, but I wanted to separate this section into a different section so that you can see the relation of these layers of the heart to the pericardium. It's something that I think a lot of students have difficulty understanding. I know when I took the course, it didn't make a lot of sense to me. And so I just wanted to separate this section so that you can see the heart in relation to the pericardium. You won't be tested on the pericardium, I don't think, for lab portion, but lecture portion, it obviously is fair game. So just want to explain that real quick. The heart rests inside of a sac, okay? And the sac is known as the pericardium, and there's 3 parts to it. There's the parietal pericardium, then there is a pericardial cavity, okay, which is filled with pericardial fluid, and then we have what we call the visceral pericardium, which is the final layer that essentially wraps around the heart. Parietal means wall, okay, so it's on the outside. Visceral means of or relating to an organ. So the visceral pericardium is right here. Then we have that pericardial cavity filled with pericardial fluid, which helps for like reducing friction and things like that as the heart beats, among many other things. And then we also have the parietal pericardium on the outside, which is essentially that tough outer paper bag that the heart sits in. Actually, if you Google search parietal pericardium, there's some pretty cool images there that will show you that exact bag that the heart is sitting in. And in relation to the lab portion, though, we have 3 different layers of the heart as well. We have a epicardium. Okay, epi means to be on top of or surrounding something, so epi, right here. Okay. Then we would have the myocardium, which is this muscle layer. Okay. And the myo means of or relating to muscle, so it makes sense that we would call the muscle region the myocardium. We also have this peach inner membrane or layer right here, okay, and that's going to be known as the endocardium, which makes sense. Endo means on the inside, okay? So the endocardium is on the inside, then we have the myocardium, and then the epicardium, which is a very thin layer on the outside. To relate this to the pericardium, the visceral pericardium and the epicardium, they're the same thing. Okay, so if you can remember that, the epicardium and the visceral pericardium are the same thing. You're going to want to call this the epicardium for the lecture exam, or for the lab exam, but I just want you to keep that in mind, that the epicardium and the visceral pericardium are the same thing. Then we would have the pericardial cavity, right, filled with pericardial fluid, and then the parietal pericardium, that outer paper bag that the heart sits in. I'm exaggerating the distances here. I mean, it's all very, very close to the heart, but just I'm moving my hands out so you can kind of see that I'm talking about different layers. Okay? But that's going to be the pericardium in relation to the other layers of the heart. Okay, next I'm going to talk about the external portion of the heart, specifically the different sulcuses. A sulcus is just a groove, essentially, and so we have 3 main sulcuses that that you will be tested on for the exam. You're going to have what we would call the atrioventricular sulcus, which is the sulcus that runs between the atrium and the ventricles. Okay, you can see it back here as well. There's lots of vessels that lay inside of the atrioventricular sulcus, but it makes sense that we would call this the atrioventricular sulcus due to the fact that it's between the atrium and the ventricles. We also see right here the anterior interventricular sulcus, which again is filled with several vessels. But it makes sense that this would be called the anterior interventricular sulcus because it's anterior, so it's in the front. It's between the ventricles, so interventricular. Okay, and it's a sulcus, it's a groove. And then we also see on the back here the posterior interventricular sulcus. When you run your finger along this on the model, it doesn't seem like it's really a groove, but it definitely is. And actually, we see in all these sulcuses, you see this yellow. And what the yellow actually is it's deposit of adipose tissue or fat tissue on the heart, which is, it's actually a good thing as long as there's not too much of it. But I'm not going to get into that right now. But wherever you see this yellow, it's because there's a sulcus right there, and that's where the fat's going to deposit inside of the heart. Okay, so in this segment, I'm going to be breaking down the 3 branches off of the arch of the aorta. We have the brachiocephalic artery, or trunk. We have the left common carotid artery, and then we also have the left subclavian artery right here as well. A nice mnemonic to remember this is the mnemonic Battle Creek sucks. I don't think Battle Creek sucks. I'm sorry if you're from Battle Creek. I don't mean to offend you. But it's just a nice way to remember it. So battle, brachiocephalic artery, or brachiocephalic trunk. Creek for common carotid, specifically the left common carotid, and then sucks for left subclavian artery. Okay. Now, for the lecture portion, You also need to be familiar with what actually happens with this brachiocephalic artery as well, and you can actually see it on the circulatory man. So I'll go ahead and just break that down. Eventually, if we were able to continue on with this brachiocephalic artery, okay, it's going to bifurcate into the right subclavian and the right common carotid. So what we would actually get is kind of this mirror image where we would have right subclavian, right common carotid, left common carotid, and then the left subclavian over here. So just to kind of give you an idea of what you're seeing, again, for the lab portion, you'll see that on the circulatory man. And then for lecture portion, you're going to want to know how these things bifurcate, because you're going to need to know how the blood is traveling through the vessels, like in what order. So just thought I'd show you that, show exactly what's happening here. Okay, for the final portion of this video, I'm going to be going over the vessels of the heart, the coronary arteries, and the coronary veins. The reason that I save this until the very end of this lesson is because this is where I find that professors teach pretty differently, and I guess I should say test you very differently. If you have a professor who just wants you to know the difference between what a coronary artery and a coronary vein is, it's pretty simple. The coronary arteries are going to be in red, and the coronary veins are going to be in blue. So if that's all you need to know, you can go ahead and move on to the testing portion of this lesson. Again, it's going to be in the link in the description below, and feel free to test yourself. But if you need to know the individual ones, I'll be going over that right now as well. So first thing that we're going to be looking at is the anterior interventricular artery. You see it right here. Again, there's going to be red and blue vessels kind of running side by side. It might be hard for you to see what I'm pointing to. An artery is blue. If I'm saying it's a vein, then I'm sorry, an artery is red, and if I'm saying that it's a vein, then the vein is going to be in blue. Okay, so the anterior interventricular artery right here. Many names for this. One of the more common ones is actually the widowmaker, and the reason that we call it the widowmaker is because it's coming directly off of that left coronary artery from the aorta, and you can imagine this almost as like think of like rivers, okay, or several rivers coming together. If this is the very first part of the main river, if you have a blockage or a clog right there, nothing else downstream is going to be getting the blood that it needs, and you can suffer from a massive heart attack. Happens quite commonly in men, hence why we call it the widowmaker. So just kind of a little interesting fact about that artery right there. Next, we're going to move around to the marginal artery, which we see right here in red. On the left side, we see the circumflex artery right here. Okay, moving on to the cardiac veins. Okay, running right down the very center, okay, right alongside, or I guess I should say running up, because the veins are carrying the blood back up, because we eventually want to get back to this right atrium. Running alongside, though, what would have been, again, right here, the anterior interventricular artery, we have the great cardiac vein running up along that, okay? So the great cardiac vein is right here. Do not confuse this with the anterior cardiac vein. It's very easy to do because this is on the anterior, so I understand that. But the anterior cardiac vein is going to be this blue vein right here. We then have the small cardiac vein just above that. And then in the very back, going along the posterior interventricular sulcus, we see the middle cardiac vein. Okay, so one more time, middle cardiac vein, great cardiac vein, anterior cardiac vein, and the small cardiac vein. And that's pretty much going to do it for the lesson on the heart. So again, go ahead and you can click on the link in the description below, and you can go ahead and test yourself on all this material. Again, the way that works is I'm going to throw the image up on the screen. You can go ahead and pause the video at home, and then give yourself some time real quick to write out the answer, and then hit play, and I will go ahead and throw the answer up so you can check that you not only know the term, but that you also have the spelling correct as well. But other than that, that's pretty much it. So best of luck on your exam, and hopefully I will see you again soon in another anatomy video.